Hi guys, and welcome to our model on the extrahepatic biliary apparatus. Now, in this model, we're talking about a number of different structures. Each of the structures in combination forms what we call the extrahepatic biliary apparatus. So structures like the common hepatic duct, the gallbladder, the cystic duct, the common bile duct are the major structures giving rise to this apparatus. Would also make mention of the blood supply, nerve supply, the hepatic drainage, histology, and as well some landmarks to each of the structures. Now, the components of the extrapillary apparatus, as I had mentioned before, includes four major structures. These structures are largely docked with one major storage compartment, which is the gallbladder. So this includes the common hepatic duct, which is the starting point. It's the most proximal structure, followed by the gallbladder, followed by the cystic duct, and then ending with the common bile duct, which is the most distal structure. This is an image that shows for us all the components of the extrahepatic biliary apparatus. The function of this set of structures will be to transport bile produced from the liver to the end organ or the end structure, which is the duodenum. And as you notice, proximal to distal, each of those structures are outlined here. We have the common hepatic duct proximally, followed by the gallbladder at the side, then the cystic duct towards the side, and then finally ending with the common bile duct at this point. So the common bile duct is going to be combining with the main pancreatic duct. I talked about the main pancreatic duct when I discussed the pancreas in a different model. But the combination of those two, the common bile duct and the main pancreatic duct, will give to us or give rise to the ampulla obfata, which will drain bile into the duodenum. This is a clearer image of the components I mentioned, and you can see they're all color coded. We have the common hepatic duct in green, followed by the gallbladder here in a bit of gray, and the cystic duct just emerging from the gallbladder. The combination of the common hepatic and cystic duct will give us the last structure there called the common bile duct. Common bile duct would eventually form the ampulla obfata when it combines with the main pancreatic duct, as shown in the image here. So the next set of slides, we'll be talking about each of the components of the extrahepatic apparatus, starting with the common hepatic duct. The common hepatic duct is the first part of the extrahepatic biliary apparatus. It is about 4 to 8 centimeters in length and about 4 to 6 millimeters in diameter. The length is very important to remember. It is located at the porta hepatis. Porta hepatis is the entry point for majority of the vascular structures, neurovascular structures, and hepatic structures into the liver. So the common hepatic duct is found at that side because remember it's the starting point for the extrahepatic biliary apparatus. So it's the first drainage point of bile outside of the liver. Hence the reason why it's found at the porta hepatis. Aside that, the common hepatic duct arises from two smaller ducts called the right and left hepatic duct. So we have the right and the left hepatic duct uniting to form the common hepatic duct. And once the common hepatic duct is formed, it would terminate by combining with another duct we'll talk about next, which is the cystic duct, to give rise to the common bile duct. So this is just an image showing for us the common hepatic duct. You can see how the common hepatic duct begins from a combination of the right and left hepatic ducts. These ducts are intrahepatic because they're found within the liver, so they're not usually described as part of the extrahepatic biliary apparatus. But the combination of those two ducts, the right hepatic and the left hepatic ducts, will give rise to the common hepatic duct. And then the common hepatic duct descends down to about 4 to about 8 centimeters in length. And in terms of termination, it terminates by uniting with the cystic duct to give rise to the common bile duct as shown in the image. All right, the gallbladder is the second important component of the extrahepatic biliary apparatus. It's the largest part of this apparatus, and unlike the rest, it is not a duct, but it is rather an organ. The gallbladder is an intraperitoneal organ, meaning it is wrapped around almost entirely by peritoneum. It is located in the right hypochondrium when talking about the region of the abdomen. And very importantly, the site where we find the gallbladder is usually on the visceral surface of the liver, just between the right lobe and the quadrate lobe of the liver. We'll talk about the lobes of the liver when we get to the module under the liver. But in terms of its location, that site, that area between the right lobe and the quadrate lobe of the liver is referred to as the cystic plate or the gallbladder bed. The gallbladder is about 7 to 10 centimeters in length. It has a capacity of 30 to 50 mils. That's in terms of storage of bile. And in terms of shape, it is described as a pear-shaped organ, as you see in the next slide. The gallbladder could actually hold up to about 300 mils of bile if there is no obstruction, but the capacity tends to just be restricted to 30 to 50 mils. Well, it could be distended all the way up to 300 mils of bile. That's important to note. Different parts of the gallbladder. The gallbladder is divided into three major parts, as outlined in the image below. You can see each of those parts are color coded for you. From proximal to distal, we start with the fundus of the gallbladder, and that's the highest part of the gallbladder. Then the body, the largest part, and the neck, the smallest part of the gallbladder. We'll talk about each of them next. Now, with regards to the fundus of the gallbladder, it is the most proximal and most distended part of the gallbladder. In terms of its location, it is found at the right um, ninth costal cartilage at the mid-clavicular portion or mid-clavicular line, and it is related to the first part of the duodenum anterior. It is very important to remember. The body is the longest part of the gallbladder. It lies just between the fundus and the neck. The body of the gallbladder is related to the transverse colon, to the liver, and to the first part of the duodenum. So it's related to more parts compared to the fundus, and that's because of its length. Because it spans a larger length vertically, to be related to a number of organs aside the first part of the duodenum. Then finally, we have the neck of the gallbladder, which is the narrowest portion of the gallbladder. It is S-shaped. It has an S-shaped bend, and this is significant when talking about the different pouches which tends to form when we look at its internal structure. The neck is the terminal or distal part of the gallbladder. It tends to terminate by joining the cystic duct, and eventually the cystic duct to drain to combine with the common hepatic duct to form the common bile duct. These termination points of the neck of the gallbladder into the cystic duct usually tends to be found at the portal hepatic. One thing to note about the neck, which I mentioned with regards to its shape, remember it has this S-shaped bend, is that the neck of the gallbladder contains rough muscular folds, and that's when we cut it in and look at it internally. We tend to see these muscular folds that we don't see elsewhere, and these rough muscular folds we see is referred to as Hartmann's pouch. It is the common location for gallstones to tend to lodge in, and the gallstones that tend to lodge within the neck would give rise to a condition we call um, cholecystitis or cholelithiasis rather. And this is a picture of the gallbladder. You could see the gallbladder being this pear-shaped organ as described. The most proximal portion here is the fundus, and followed by the body of the gallbladder, as you can see. And then finally, the terminal points would be the neck of the gallbladder, which eventually would drain to become the cystic duct. You can see that the neck of the gallbladder here is forming a bit of pouch here, and this pouch is Hartmann's pouch that occurs due to this S-shaped bend that you can witness here. And this is a common site where gallstones could dislodge and eventually lead to cholelithiasis. Let's talk about the cystic duct. This is the third component of the extrahepatic biliary apparatus. It's the shortest part. It's short in terms of length. It tends to run from the neck of the gallbladder towards the common hepatic duct, and the entire length of the cystic duct is about 3 to 4 centimeters in length. It is also located very close to the portal hepatis, and its termination point is formed when it unites with the common hepatic duct to form the common bile duct. And this is an image showing us the cystic duct in real life. You can see how the gallbladder would eventually go from the neck towards the portal hepatis to form the cystic duct, and then from there, cystic ducts will combine with the common hepatic duct to give rise to the common bile duct, as you can see. It is the common bile duct, it is the common hepatic duct uniting with the cystic duct. Now you can see the formation at the end, and this is all occurring at the portal hepatis, at the point where you have entries of multiple neurovascular structures within the liver. The final structure in the component of the extrahepatic biliary apparatus is the common bile duct. This is the longest part of the extrahepatic biliary apparatus in terms of length. It's about 10 to 15 centimeters in length and about 4 millimeters in diameter. it tends to be located lower down. It's found in the within the free edge of the lesser omentum. Remember, the lesser omentum has the free edge. The particular part of the lesser omentum we're talking about is the hepatoduodenal ligament of the lesser omentum. That free edge portion contains a number of structures we refer to as the portal triad. Remember that the portal triad is made up of the portal vein, the hepatic artery, and then the common bile duct. So the common bile duct is one of the structures found within the free edge of the lesser omentum. The common bile duct begins as a union between the cystic duct and the common hepatic duct. So that's its origin point. And as it descends behind the first part of the duodenum and the head of the pancreas. And then eventually it ends at the it just ends directly close to the first part of the duodenum or second part of the duodenum rather by joining with the main pancreatic duct of Wilson to form the hepatopancreatic ampulla of Bartter. So that ampulla of Bartter tends to empty in the second part of the duodenum, which is the termination point or location of the common bile duct. The common bile duct tends to contain a sphincter at its distal end. This sphincter is called the sphincter of the bile duct. This sphincter tends to be continuous with the sphincter we find in the in the hepatopancreatic ampulla of Bartter, rather, which we know as the sphincter of Oddi. Remember that these sphincters are there to restrict or limit the entry or exit of bile through the extrahepatic biliary apparatus once they are at the termination points into the duodenum. Now, this is the image showing for us the common bile duct alongside other structures of the extrahepatic biliary apparatus. You could see the right and left hepatic duct giving rise to the common hepatic duct. You can see that common hepatic duct uniting with the cystic duct. Cystic duct is going to be draining bile from the gallbladder, and then finally the combination of the two will give rise to the common bile duct. Common bile duct, what you notice about it is that it is found just directly behind the first part of the duodenum and then descends down all the way to the second part of the duodenum. At the second part of the duodenum, it tends to be united with the main pancreatic duct of Wilson and gives rise to the ampulla of Vater. You can see it. The ampulla of Vater is what eventually would empty into the second part of the duodenum. Let's talk quickly about the blood supply. The common hepatic gallbladder and the cystic duct share a similar supply. They are all going to be supplied by the cystic vessels. The common bile ducts were asked because of its lower location in terms of anatomy tends to be supplied by multiple different vessels. It's supplied by the cystic vessels, right hepatic vessel, the posterior superior pancreatic duodenal vessels, and the gastroduodenal vessels. So multiple vessels supplying the bile duct as it descends from the porta hepatis towards the second part of the duodenum. The net supply to these structures are also quite similar in the sense that for somatic innervations, they are all supplied by the right phrenic nerve. In terms of autonomic innervations, the supply is coming largely from the celiac plexus, which comprises of sympathetic fibers and parasympathetic fibers. Sympathetic fibers of the celiac plexus originates from T6 to T12 nerves, and then for the parasympathetic fibers, they all come from the vagus nerve, which is cranial nerve 10. For lymphatic drainage of the extrahepatic biliary apparatus would all end at the pre-aortic lymph nodes, particularly the hepatic nodes and then the cystic nodes. And this makes a lot of sense because these nodes are related very close to the liver and very close to the cystic duct. Hence the reason why they're going to be draining a number of the structures around that region. Histologically, the extrahepatic biliary apparatus is comprised of the four walls. Each of the different structures we mentioned, from the common hepatic to the gallbladder to the cystic duct to the bile duct, contains four walls of structures with a lumen in the center. Each of these structures includes the mucosa, submucosa, muscularis propria, and serosa. The mucosa of the extrahepatic biliary apparatus are all lined by simple columnar epithelium, and that's very important to note when discussing the histology. To conclude this model, we'll talk about the landmarks in relation to the extrahepatic biliary apparatus, and there are two major landmarks to remember. These are the hepatocystic triangle, which we'll talk about now, and the Charlotte's triangle we'll talk about next in the next slide. For the the hepatocystic triangle, also called the hepatobiliary triangle or the Rocos triangle, is a triangle that is located within the or around the extrahepatic biliary apparatus. It is bounded superiorly by the inferior border of the liver, bounded laterally by the cystic duct and the neck of the gallbladder, and then bounded medially by the common hepatic duct. I'll show you a picture of how this looks like. The content of the hepatocystic triangle is very important to remember. This includes the cystic artery, cystic lymph nodes, the right hepatic artery, and then cystic nodes of the lung. And these are questions which I can ask you both in MCQ alongside essays when preparing for your proofs. All right, this is the picture of the hepatocystic triangle, also called the Buderocus triangle. You can see its different landmarks from the inferior landmark, which or superior landmark rather, which is the inferior border of the liver, to the medial and lateral landmarks are shown in the image here. Each of these landmarks eventually will give rise to the triangle, and within the triangle we have different structures there. Although what is practically shown here is the cystic artery, but other structures like the cystic lymph nodes and the right hepatic artery are also among the content of the hepatocystic triangle. The second landmark is the Carlos triangle. Carlos triangle is bounded superiorly by the cystic artery, bounded laterally by the cystic duct, and then bounded medially by the common hepatic duct. And the major contents found within the Carlos triangle is the cystic artery. So it's found in both the Carlos triangle and the hepatocystic triangle. And that's one important thing to remember. We don't find the other structures that we see in the hepatocystic artery as content of the Carlos triangle, just the cystic artery. Once again, just to remind ourselves about each of the different landmarks, we have the hepatocystic triangle and the Carlos triangle shown here. The hepatocystic triangle is more superiorly, whereas the Carlos triangle is more inferiorly. And unlike the hepatocystic triangle, the Carlos triangle has the cystic artery being its major and even only contents alongside it being also superior border. So superior border is the cystic artery, lateral border and medial border will be the cystic duct and the right hepatic artery. And this is distinct from what we have for the hepatocystic triangle. Just pay attention to each of the boundaries alongside the contents because they are common questions they can ask you in your MCQ as said before. Let's complete this model by talking about the clinical significance. We'll talk about conditions that are related to the hepatic, extrahepatic biliary apparatus, things like biliary colic, cholelithiasis, cholecystitis, cholido- cholelithiasis, cholangitis, and cholangiocarcinoma. These are just issues that could occur at any point in the extrahepatic biliary apparatus. Biliary colic tends to be problems with the gallbladder in which there's pain within the abdomen as a result of contractions of the gallbladder, either due to presence of stones or just due to inflammation. Cholelithiasis just refers to storage or presence of stones within the gallbladder, we call gallbladder stones, or presence of stones within the cystic duct. So it could be stones within the gallbladder or stones within the cystic duct. Then we have cholecystitis. Cholecystitis is simply an inflammation of the gallbladder. Then we have cholelithiasis. Cholelithiasis refers to the presence of stones within the bile ducts. It's a bile duct stones, which are probably stones coming from the gallbladder moving into the common bile ducts. Then we have cholangitis. Cholangitis is simply inflammation of the bile ducts, of the common bile ducts. And then cholangiocarcinoma is a type of tumor or neoplasia that is found within the bile duct. So it's a bile duct cancer or bile duct malignancy. And these are all the clinical significances in addition to the extrahepatic biliary apparatus. I will show you pictures along the line of each of them one by one. So this is an image of a gallstone. Gallstone, which we refer to as cholelithiasis, could either be stones within the gallbladder, as you can see here, or stones within the cystic duct. Either of these two would pass as what we call cholelithiasis. So cholelithiasis could either be problems with either the cystic duct or problems with either the gallbladder. Then we could have stones within the bile ducts. Bile duct stones are usually referred to as the as cholelithiasis. So cholelithiasis is stones within the bile duct, whereas cholelithiasis it refers to stones within the gallbladder or cystic duct. Then we have cholangitis. Cholangitis is simply an inflammation of the bile duct, as you can see. It could be due to presence of stones, could be due to infectious causes, or otherwise. But the primary thing is that unlike the cholelithiasis and cholangitis, we tend to have inflammation occurring alongside whatever is causing the inflammation. So gallstone disease tends to present in multiple ways. Usually, when there's a gallstone disease, either cholelithiasis, cholangitis, or cholelithiasis, we have symptoms that we tend to see Usually, we tend to remember some of the symptoms with the triad, popularly called Charcot's triad. Just remember, we have a Carlos triangle and we have a Charcot's triad. Charcot's triad refers to the constellation of symptoms that we see that would point us towards the gallstone disease. And this would include fever because of the inflammation, jaundice because of lack of flow of bile into the duodenum. And remember, bile contains bilirubin. If bile is not flowing well into the duodenum, meaning bilirubin was going to be accumulating in the extrahepatic biliary apparatus, and that will lead to bilirubin entering into the blood. Once bilirubin enters into the blood, automatically that raises the level of total bilirubin, and that can lead to jaundice, which is yellowish discoloration of the skin and sclera. And then, most importantly, because this is occurring within the gallbladder and within the abdomen, we tend to have very similar form of pain or acute abdomen around the right upper quadrant or around the right hypochondrium, which is the location of the gallbladder and the location of other aspects of the extrahepatic biliary apparatus. And finally, we have the last clinical significance, which is cholangiocarcinoma. This refers to tumor of the extrahepatic biliary apparatus. It could either be tumors of the bile duct, tumors of the gallbladder, tumors of even the intrahepatic apparatus. You could see intrahepatically, you can have an intrahepatic cholangiocarcinoma occurring, although this is rare. But most of the time, what we tend to see would be cholangiocarcinoma occurring within the bile duct and the gallbladder. Either ways, these are tumors that are highly deadly and tend to have very poor prognosis as a result. That concludes our module on the extrahepatic biliary apparatus.